Hello, my name's Kate, and this is my health advocacy statement. To the chairperson and distinguished members of the Oregon State Legislature Health Care Committee, I write to you for statewide support of the implementation of culturally sensitive postpartum depression, PPD, screening programs across all prenatal, postpartum, and pediatric healthcare settings. Postpartum depression is one of the most common complications following childbirth, affecting approximately 1 in 7 women after every delivery. Despite effective screening tools and evidence based treatments, many women remain undiagnosed because screening is inconsistent and fails to account for cultural differences, language barriers, and social stigma surrounding mental health. Women from racial and ethnic communities, immigrant populations, refugees, and women with limited English proficiency experience additional barriers that prevent timely identification and treatment of postpartum depression. Symptoms may include persistent sadness, anxiety, hopelessness, excessive guilt, inconsistent sleep, difficulty bonding with the baby, changes in appetite, and thoughts of self harm or harming the baby. Without more immediate intervention, these symptoms can cause severe deficits in the health of both the mother and baby. In addition, if left untreated, these symptoms can lead to long term health crises. Untreated postpartum depression extends beyond the individual mother and can have lasting impacts on families and communities as a whole. Mothers experiencing untreated depression are at risk for poor physical and emotional health, difficulty bonding with their baby, reduced parenting confidence, and chronic mental illness. In turn, this may result in infants experiencing delayed cognitive, emotional, and behavioral development. Families may also experience increased stress, strained relationships, and financial hardships in relation to prolonged healthcare needs. These outcomes are disproportionately experienced by underserved populations. Women from ethnic minority communities frequently report language barriers, difficulty accessing healthcare, inadequate interpreter services, culturally insensitive communication, fear of judgment, and uncertainty regarding how screening information will be used. Through research I discovered in a recent qualitative study, also described not understanding the purpose of mental health screenings due to healthcare providers failing to explain the screening process or access to available resources after screening. These barriers contribute to delayed diagnoses, reduced treatment engagement, and widening maternal health disparities. I respectfully ask this committee to support legislation requiring universal postpartum depression screening using culturally sensitive, evidence based screening tools throughout pregnancy as well as into the first postpartum year. Screening should be conducted in multiple languages with professional interpreters when needed, accompanied by detailed and clear explanations regarding the screening and its purpose, confidentiality, and treatment available if needed. In addition, healthcare professionals should receive ongoing education in culturally competent communication and trauma informed care to improve the trust between providers and patients. This will help increase patient engagement and comfortability engaging with providers. Healthcare systems should also establish a standardized referral pathway to ensure women who screen positive receive timely access to mental health services and continued follow up. These changes proposed will improve early detection, reduce disparities in maternal mental health care, strengthen patient provider relationships, and ultimately improve health outcomes for mothers, infants, and families in Oregon. Thank you for your time and consideration concerning this issue. Every mother deserves equitable access to compassionate mental health care regardless of her race, language, culture, or socioeconomic background. By investing in culturally sensitive PPD screening, Oregon can reduce preventable suffering, improve health outcomes, and show our mothers how invested and supportive we are for their health all around. Thank you.